All right, welcome everybody. Oh, it says 72, but it feels lower. The air is nice. That does sound nice. We're already at 81 degrees. All right, thank you so much for playing along with me. I'd love to know where you're all from. As I mentioned, we're located in Iowa, so I always like to talk to other people and see what's going on in your part of the world and go from there. So we're going to start. We have a full almost 60 minutes presentation today. I'm excited to be here. I'm excited that you are sharing your time with me. I really, really appreciate it. First, I'd like to just do a shout out to the South Carolina Department of Health and Environmental Control. It's because of our partnership with them that we are able to share these resources with you, have these types of webinars. You can order free materials, all because of our great partnership with them. So let's go ahead and get started. Feel free to ask questions in the chat box or I guess there's no Q&A with this one, but the chat box, and then I will answer all the questions at the end. But I like you to add them in just in case like you forget it or I want to make sure to answer them. And I might answer your question as we go, but this way we don't forget it. So with that, I'm going to turn off my camera because I have several videos to show, but then I'll turn it back on at the end. So again, my name is Megan Ockett. I'm the program director with Healthy Birthday. Healthy Birthday is the nonprofit organization that created Count the Kicks, which is what we're talking about today. My contact information is on the screen. Feel free to reach out. I love hearing from everybody on the community level because you guys are the grassroots. So you are the ones that are going to take what you learned today and implement it in your area. So if you need something from me, you need a different language, you have other ideas, I need to know because you're the ones that are making this better and you're the ones that are doing this and sharing it with your expectant parents. I have a 15-year background in public health. I'm very passionate about systems level change. So we'll talk about that a little bit on how you can integrate Count the Kicks into your current workflow. And then obviously I'm very, very passionate about maternal and child health. I have three little babies of my own, 9, 6, and 3. So this is very near and dear to my heart. And I'm excited to share this with you all today. So with that, we'll go ahead and jump right in. So one of the most powerful and effective ways we have really found to educate expectant parents is the use of our mom-to-mom storytelling. So through testimonials of those whose babies were saved from counting and tracking their fetal movements in the 3rd trimester. And we really have seen a ripple effect, helping expectant parents know how to know about this Count the Kicks campaign and to speak up to their provider if they notice a change. And so I like to share this video for a couple reasons. One, it's just a feel-good video to start off the presentation, right? You will have a smile on your face at the end and you will remember baby Ruby after this is all said and done. 2, it does a good job of just showing you a little bit more about what Count the Kicks is. If you're not that familiar with it, it does a good overview of how to use the app and how it can work. And 3, after this aired on Good Morning America, we saw a huge, huge percentage spike in our app downloads. We know the power of that storytelling. So anytime you have the opportunity when you're working with expectant parents and you have the opportunity to share this type of message, to share these stories, share them because this is what they're going to remember. This is what you're going to remember today. You're going to remember baby Ruby and how she was saved when her mom was using the Count the Kicks app. So let's go ahead and watch.
We're going to turn now to that GMA parenting alert about a free app. A mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
Just a cute little video to start off. So baby Ruby, that little stretch at the end just gets me every time. So now that we saw that, let's go ahead and dive right into the data and research behind the campaign. Just to level set, I think based on where you all said you work, we're all familiar with the definitions and what each one means, but just to confirm, miscarriage is usually defined as loss of a baby before the 20th week of pregnancy, and stillbirth, which we're talking about today, is the loss of a baby after 20 weeks of pregnancy. And on average, we lose 23,500 babies every year to stillbirth in the United States. Infant mortality, which is the one that's most commonly confused with stillbirth, is the death of an infant before his or her first birthday. And on average, 22,000 infants die every year in the United States. So what I want you to take away from the slide is the fact that we're losing just as many babies to stillbirth, actually slightly higher, than to infant mortality. And that's not to underscore the impact of infant mortality and the tragedy of it. What I want it to do is to highlight the fact that we don't talk about stillbirth the same way we talk about infant mortality. We don't talk about counting fetal movement the same that we're talking about laying baby on their back to prevent infant mortality and SIDS prevention and things like that. So what I want to do is give you the tools and resources to be able to talk about stillbirth and stillbirth prevention as much as you can talk about infant mortality, and people are talking about that. And that's what we want to do today. So national data, if we take a little bit closer look, we know that 1 in 169 pregnancies ends in stillbirth, and the racial disparities are huge. For Black women, it's 1 in 96. Hispanic, Latinx moms, it's 1 in 199. Indigenous women, 1 in 138. White women, 1 in 204. Asian Pacific Islanders, 1 in 233. Again, it's just as prevalent as infant mortality. Families are 10 times more likely to lose a baby to stillbirth than to SIDS. In fact, if you break that 23,500 up, that's 65 babies a day. So think of that like a busload of kindergartners, that's 65. Roughly. So that would be all over the news. That would be all over the media. So why aren't we talking about this? This is a public health tragedy. If we look a little bit closer at your data in particular for South Carolina, the stillbirth rate is 6.84 per 1,000 live births. So unfortunately, you all are in the top 10 for the highest stillbirth rate. The national average is 5.96. 1 out of 130 pregnancies in South Carolina will end in stillbirth. South Carolina loses approximately 395 babies to stillbirth every single year. And with our campaign, where we're seeing a 32% reduction in the number of stillbirths in Iowa, so we're saving 1 in 3 at-risk babies in Iowa, we have the potential of saving 136 babies from preventable stillbirth in South Carolina. So you may be wondering, how am I getting to that 32% and that's 1 in 3 at-risk babies? And this is how. So Count the Kicks was created in 2008, where you can see that teal dot is one of the highest there on the chart. It was developed by 5 Central Iowa women, who I'll talk about here in a minute. But from 2008 to 2018, you can see there's quite a sharp decrease there. And we saw a 32% reduction in the number of stillbirths in that decade alone. Even in 2021 preliminary, we're still around that 32% reduction. So when I say we could save 136 babies from preventable stillbirth, this is what we're calculating that based off the success we've seen in Iowa. This is what we want to see happen in South Carolina. So what we really pay attention to is that dash line, that trend. we want to see that trend continue to decrease. Of course, there's always outlier years like that, like in 2019 and 17, and things like a syphilis outbreak or a pandemic can exacerbate those issues. And so that's why we really want to look at that 3 to 5 year averages and that downward and that trend line. So that's what we want to see happen in South Carolina. And that's why you're here today, so that we can make that happen. So you heard me briefly talk about the racial disparities that exist. And I think it's really important to mention, to highlight this and why there is such disparities for stillbirth, and to acknowledge it and talk through ways that we can help get to a point where race is no longer a predictor of stillbirth. So researchers point to the following as causes for stillbirth: systemic racism, toxic stress. Research shows that years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society and all that comes with it, has led to real and pervasive health issues for Black women. Epigenetics, predisposition to certain conditions that may lead to stillbirth, like gestational diabetes, which are all linked to maternal stress. And experts say Black women are less likely than other races to receive early treatment for these conditions. Access to healthcare, socioeconomic barriers. Research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school educated white woman. So you may be wondering, what is Count the Kicks doing to reduce disparities in stillbirth outcomes, and what can you do? A lot of the things that we're doing, you can do as well. And you're probably already doing a lot of these things. We work outside typical healthcare settings. We provide resources to CBOs and faith-based and beauty salons and grandparents and things like that to reach everybody that can talk about Count the Kicks. We have an app in 14 languages. We're trying to be as inclusive as possible. So when we get to that part, if there's a language that you serve that you don't see, let me know. And we want to figure out a way to make that happen. We have culturally appropriate educational material, videos, educational materials, and FAQs in multiple languages. I'm a health equity director. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. We're an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. We're improving programming based on lived experiences shared by people of color, and we're working within communities considered to be marginalized. So you have the data, you have the background there. Let's talk about how this is truly an evidence-based campaign. It is research-backed and evidence-based. And the research you see on your screen here is the one that I want you to, if you're really not into research and reading lots of journals like me, I want you to read just one. And this is the one I want you to read. And it's on our website, on our evidence page. And I want you to read this one because this is the research study that started it all. This is the research study that basically created Count the Kicks. So I briefly mentioned earlier that Count the Kicks was developed by 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. And they didn't know each other at the time of their loss. They actually got connected through pastors and friends. And as they were grieving together, sitting there thinking, why was I told stillbirth is not that common when here we all sit looking at each other with relatively the same story around the same time period? You know, this is a lot more common than people think. And so, long story short, a couple of the founders were at a public health conference on stillbirth, and one of the researchers there talked about this study out of Norway that showed when expectant parents were educated on getting to know what's normal for their baby in the 3rd trimester, that among this cohort, the stillbirth rate decreased around 30%. Just by educating on getting to know what's normal. And so the founders hearing this said, that's amazing. Like, Kit County has been around for a long time, but the tools and resources and the systems level change has not been. So what if we come back and create an upbeat, empowering campaign that encourages expectant parents to know what's normal for their baby and how to speak up if they notice a change, and tools and resources for providers, CBOs, doulas, to be able to have that stillbirth prevention conversation with their patients. So that's exactly what they did. They came back to Iowa. They worked with Iowa Department of Public Health. They looked at other research that also shared about the importance of tracking fetal movement and created the Count the Kicks campaign as we know it today. So this one quote from Dr. Ruth Fretz, who is one of the researchers on that Norway study, she's also part of our medical advisory board now, and she states, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. So what's most important about this slide is the fact that normal movement pattern. That's what we're going to really highlight in the next couple slides here coming up. So we are also named a best practice by the Association of Maternal Child Health Programs, or AMCHIP. They do a thorough scientific review of programs across the United States. And so through that, they decided that we were should be considered a best practice among their standards. So we're super excited about that. We also know that CDC supports this in their Hear Her campaign, which I'm sure you're all familiar with, to reduce maternal mortality in the US. The CDC lists 15 urgent warning signs for expectant parents, and the importance of paying attention to baby's movement is one of the key markers. I think my top question I get, and I say that because I was just at our first conference in 2 years in person. We went to the ACOG, so the College of Obstetric Gynecology Conference, the national conference. And my top question we get is this going to increase anxiety? Is this going to increase my nurses to run around and answer calls? Basically, I have been asked that before, just like that. And I can absolutely with certainty say that this does not increase anxiety in most pregnant women. This study here stated that one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true, and that usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. We have done our own study as well with the Des Moines University and the Harkin Institute, and found that 84% of app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. They also stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, preliminary research shows the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirth. Because if you think about it, especially with the app, we now have an educated expectant parent that knows what's normal for her baby. She has data in her hands to feel comfortable going or not going to her provider based on that. So it's kind of like that data download of the intuition. So we'll talk about that in a little bit. I think there's other benefits too that people don't realize. It's not like every situation with a change in fetal movement with a mom, when they come into triage, is that they automatically have a delivery, right? It could be an indication that something else is going on. Maybe baby's trying to be born early and something needs to happen to make sure that doesn't happen. So we do know that there's a reduction of preterm birth rate. Fetal growth restrictions can be identified earlier. We also know that women who have stillbirths are at substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of death. So due to the low cost and potential benefit, this researcher says it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. So talking about that connection between stillbirth and maternal mortality and morbidity, they're intrinsically connected. You are 4 times more likely to lose your life if you have a stillbirth. So if we can prevent stillbirths, we have the potential to save mom's life as well. We just recently released a white paper on this connection, and it's on our website, and I will send it out after the webinar with a direct link to it. So it has firsthand accounts from American women, and it has the data all in there so you can see the true connection between the two. All right, let's talk about how to implement this. So again, Count the Kicks is an evidence-based stillbirth prevention public health campaign. It's an early warning system for expectant parents. It educates women and expectant parents on the importance of tracking fetal movement through our mobile app and paper charts. It empowers expectant parents to speak up to providers if there's a concern. And 1 in 3 at-risk babies can be saved by Count the Kicks. So why do movements matter? Movement is one very important way a baby communicates before birth. And we know, and research shows, that a change in a baby's movement can be an early sign and sometimes the only warning sign that a baby may give when in distress. It's the way they communicate with the expectant parent. So why do babies' movements change when they're in distress? It's almost very simple to think about. It's just like when you and I are sick, we change our activity level. When you and I are sick, we're sitting on the couch, we're laying in bed, we're sleeping a lot, we're not drinking Mountain Dew and eating a lot of chocolate to try to get up and moving again. We slow down. The same with baby in utero. If something is going on with baby, whether it's a cord issue, placenta, infection, their movements are going to change and they become weaker during the time of distress. So this is just the way that they naturally preserve blood flow to vital organs such as the brain and heart to conserve energy and self-protect. So it's very important to pay attention to the movements. So let's spend just a moment on talking about the movements, because I think a lot of people will say reduced fetal movement, and that by far that's probably the most common that people are seen for. But there's really 3 movements that we want to, or changes that we want to be aware of, that we want to talk to expectant parents about. So of course, if baby has fewer or no movements, they slow down, that's cause for concern and should be their provider should be notified. Another important factor is baby may move, but movements are softer or weaker. You heard that in baby Ruby's story where she says her movements just felt weaker, very light. Or the third type of movement change would be a sudden wild surge of movement that can also be an important sign of distress. So research shows this, and we've talked to a lot of lost moms who said it was almost like a very aggressive, violent surge of movement, not their normal, right? It's all about knowing what's normal for your baby so that you can detect any of these changes and contact or go to your provider right away. So when should you be doing this? When should you be talking to your clients, your patients about this? We want you to start talking about count the kicks at 28 weeks. So right at the beginning of that 3rd trimester. If your patient or client is considered high risk, start that conversation earlier because they're more at risk of having a subsequent stillbirth. So this is really when research has shown that baby has established a consistent pattern that mom can feel and track. And so you're going to get asked, well, we're calling count the kicks, so is it only kicks? No, that's just the name. It's rolls, it's kicks, it's jabs, it's pushes, anything except hiccups. Hiccups are involuntary movements, so they don't count. So this is it. This is how simple it is. This is how Count the Kicks can help your patients and clients be in tune with their baby and their body. So this is just a simple graphic that just walks through the steps of how to count kicks. So starting at the 3rd trimester, we want people to count daily, preferably around the same time. So downloading the app or getting our paper kick counting charts on our website for free. Counting movements every day, preferably at the same time, like I just said. Research does show that evening is the best time to count movements. I would not get too hung up on that, only because I know people work a lot of different schedules. The most important thing takeaway would be to do it around the same time every day, because that's when you're going to start to see that pattern with that baby during that time. So all they do is time how long it takes baby to get to 10 movements. After a few days, they're going to begin to see a pattern for their baby, the average amount of time it takes to get to 10 movements. The app, which we'll talk about on the next slide, does a really good job of visually showing them that pattern, but the paper chart works just as well. And then continue tracking every day and calling your provider right away if they notice a change. I think this is really important for you all to stress with your expectant parents, because I don't know if we have anybody that sees them as on today that is like their OB provider, but stress to your parents that they are empowered to speak up to their provider. They are empowered to say, hey, have you heard about this Count the Kicks app? My home visitor told me about it. I want to show you. Empower them to do this, because that makes all the difference. So now I'm going to do my, maybe my first, one of my favorite parts of the presentation. I love the baby safe videos, but I also love this part because I get to say what no presenter in your life has probably ever said. And I get to say, take out your phone because I want you to download the app. I want you to multitask while I'm talking, because I know we live in the United States and we can all multitask. I want you to download the app so you can see how easy it is to use. So when you're working with your patients and clients, when you're seeing them for visits, you can pull out your phone and say, hey, you're in the 3rd trimester, or you're 27 weeks. I'm going to see you again in a couple weeks. Let's just go ahead and download the app right now together and walk through it together. Our free app is evidence-based and it's available in 14 languages. So you can see those languages on the screen there. And so how it works is once you download it, it's completely free. There are no ads. Is mom sets up an account and she hits that big red button when she's ready to start counting. When she gets there, she feels the first movement that she wants to start with, and she taps that footprint that you see on the screen there. Once she starts that first tap, the timer will start. So every time she feels a movement, a jab, a poke, a roll, she taps that footprint until she gets to 10. Once she gets to 10, what will happen is that it will ask her about strength, which I'll show you on the next screen. But what will happen after that is that she will see a graph like the one you see behind that image on the right, where it shows a very linear graph. It starts to show mom after a couple sessions what the average amount of time is it took baby to get to 10 movements. So you can visually see for this example that this baby takes around 15 minutes and 24 seconds. Some days it was 17 minutes, some days it was 16 minutes, other days it was 15 minutes. What's really important is to see that graph so you can see for the most part, it's pretty linear, right? Like it's pretty similar all the way across. So if I was counting, and this was my baby's normal, it was around 15, 17, 18 minutes. And one day I'm counting and it takes, I don't know, an hour and 20 minutes. What's going to happen to that graph is there's going to be an increase on that day. So that's going to notify mom visually to say, that's not my baby's normal. My baby's normal is around 15 or 18 minutes, not an hour and 20 minutes. I need to call my provider and see what they want me to do. So then they can work with their health provider to go in and get checked out. If it's for some reason in the middle of the night or 2 a.m. and they can't get a hold of anybody, have them go into their nearest birthing center. So that's really it. That's how simple it is. Some other features that I want to share is that it's available on both Apple and Android. So whatever you're downloading on, doesn't matter. It should be there. Just search Count the Kicks and you'll see the little yellow clock icon. You can restart your session or delete a kick. So let's say, for example, I always think of this example because I'm potty training my 3-year-old right now. And I think if I was pregnant and counting and he ran over and said he had to go potty, I'd have to drop everything and go. If you've potty trained, you know what I mean. I'd have to run over there and go help him out. And so I think that I would have to come back and restart my session because now my time got all messed up. So that's one example. Daily reminders. I can't emphasize this enough. It is critical that people are using this correctly. And by correctly, that means using it daily around the same time each day. So within the app itself, there's a reminder section that they can set up that daily reminder. So the app notifies them every time, every day of when it's time to start counting. They don't have to go out to their own calendar. They can just do it all within the app. And then they get those push notifications that are like, hey, it's time to count your little kicker, just fun things like that. So daily reminders are important. They can review their kick counting history. And they can download that history to share with you. They can share it with their provider. They can share it with family or friends. This is so important in the world we live in today, where prenatal appointments got stretched out because of the pandemic, where telehealth appointments are prominent. They can actually share their data electronically now. You can count for single babies or twins. You can track future pregnancies on the same profile, so you don't have to set up an account each time. You can manage multiple devices. So this is where bonding really helps with the whole family too. Your significant other could have the same account and see how baby's been moving and be part of that. You could be counting on your iPad and then the next day count on your phone. So there's just a lot of different ways that we try to make it user-friendly and inclusive. And it's now available on Apple smartwatches. So I could be lying in bed and my watch goes off, it pings me and says, hey, time to count your little kicker. And I think to myself, oh, great, my phone is clear downstairs or on the side table. I'm 8 months pregnant, I'm not gonna go get it. I can just count on my watch and it automatically syncs. So hopefully you took a moment while I was talking to download the app and you're messing around with it so you can see all the other great features that we don't have time to review today. But I do wanna review this feature because this is really important. So if you remember, after you hit the little footprint after each movement, when you get to 10 from the movements, what you're gonna see pop up is that second image there that says almost done. Please fill out the following fields to finalize your kick session. So what we're doing here and what the user is doing is tracking the strength of those movements. So during that session, how strong did baby feel? 1 through 5, it's either fluttery all the way to fierce. And then they decide what the movements felt like during that session. So Fluttery, you know, would be that level 1, all the way to fierce would be that 4 or 5. It really is dependent on the user and how they feel like that. The most important takeaway here is that it doesn't decrease, right? We wouldn't want to go from 4 to 5 to all suddenly like a 1. And then they can also add notes. So the same thing with the movements is the strength also gives the user the average movement strength as well as the daily report. So you can really visually see baby's changes if there are changes. That last screen that you see is just an example to show you what it looks like if baby took significantly longer and there was a decrease in strength. I'm not saying these have to connect at all. What I'm showing you is that it's very visually to see on the app to say, oh, my strength was usually a 4 or 5 and today it was a 1. Like, that's not normal. My baby, think back to Good Morning America. She said it felt weaker, it felt softer. That's not normal. That's not my baby's normal. I need to understand what my normal is. I cannot compare to past pregnancies. I cannot compare to my friend. That's the most important thing, is what's normal for my baby in this pregnancy. Another great feature that I wanted to highlight that we just added was that there's videos on our app. And so this is a great opportunity to say, hey, download this app, watch the videos, and when I see you again, let's talk about it. This is not all of our videos. We have a whole YouTube channel. You're more than likely to go and share with your clients and patients. But these are some of the videos that are really more informational, like how to use it, why race should no longer be a predictor of adverse birth outcomes, some of our baby safe stories and things like that. So you'll find that on the menu bar. And then we're really excited to announce our latest update with the app, where we have recently launched a new resource that can be found in the menu in the resources section, and it can also be found on our Healthy Birthday website. And this is our Find Help resource. And so what this says is all you have to do is enter your zip code, and it will show you all of these different free or reduced cost services in your area. So then as a user, you can filter down even further and say, okay, I need help with financial assistance, or I need help with childcare. And it will populate all of the free and reduced cost services related to your search in your area by zip code. And so this is a continually updated resource. So if you're using this and you notice that it's missing some organizations or your organization should be on there, let me know and we can make sure that it gets added. So this is another great tool. So now let's take a moment, now that you have the background, you've downloaded the app, to just watch the app in action.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So that video is specifically on our app, but it's also on our YouTube channel. So you know about the app, you know about the data, you know about the research, how it's evidence-based. How do you talk about this? How do you bring this up with your clients and patients? So again, we want to be talking about this at 28 weeks. So right at the beginning of their 3rd trimester, or 26 weeks if they're high risk. Use open-ended questions. Think motivational interviewing. How would you describe your baby's normal movement pattern? Let's talk about how to track your baby's movements, sharing how movements are jabs, rolls, pushes, again, anything but hiccups. Stress how it's about learning their baby's normal time to get to 10 movements. It's a way to bond with baby. It can help reduce anxiety. And then sharing the app can help them bond, like I just said. So if you are a provider on the call today, if you do the glucose test, that's a perfect time to download the app. So say, here, drink this awesome liquid, sit here for an hour while we wait for your next blood draw, download the app, here's a brochure, let's talk about it when you come back. Perfect opportunity to do that. So think through things while I'm talking today of how you can easily add this into your workflow to talk about. We understand that it is scary and not a topic nobody wants to talk about. But we also understand, and you all know, that pregnancy is full of risks that we talk to expectant parents about. And stillbirth is another risk that parents need to be and deserve to be educated about. We talk about the, certain tests that should be done and taking prenatal vitamins and why, and not eating soft cheeses, for goodness sakes. Like, we should be talking about this. Expectant parents should not be seen as delicate flowers that can't handle this. We need to talk about this. Or maybe you think stillbirth just happens, there's nothing we can do, but there's warning signs if moms know what to look for. Again, that change of fetal movement. Her baby's always active, it's not a concern. I get this one a lot, like at baby showers or talking to my expectant parents or my friends, and they say, oh, I don't need to do that. It's like a jungle gym in there, baby won't stop moving. And I always say the same thing to those people. I always say, that's so awesome. That's so exciting. A healthy baby is an active baby, but it's still really important to know what's normal for your normally active baby so that you can be aware of any changes, because cord and placental accidents can be sudden. So you need to know what's normal for your baby so you don't have to second guess yourself. It takes a second guesswork out of that. She's almost at her due date. The risk of stillbirth actually increases as a mom approaches or exceeds her due date. So what about talking to expectant parents who have had a stillbirth previously about fetal movement? You would follow the same protocol that we just talked about for the conversation, but you would start doing it earlier, because remember, they're at risk of having another one. So you want to start this conversation around 26 weeks. So if you are their provider listening today, of course, you will have read their chart, or maybe you're not their provider, but you do know their history, or you're just meeting them for the first time and they tell you, feel free to talk about the previous stillbirth and acknowledge her child that was born still, asking about the name, gender, if you weren't her previous provider or her previous contact for the role you play now. Staying away from medical terms like fetal demise, being empathetic, I think goes without saying, but I'll say it anyways. And then ask, has anyone ever talked to them about the importance of tracking fetal movement before? A lot of the moms we've talked to, a lot of our lost moms, a lot of our ambassadors have said that they have had previous live births, they have 3 other kids or 2 other kids, and they had no idea how important this was, and that they noticed a change in movement. They just didn't know to speak up. Like, why didn't they know? Why didn't I know? We hear that time and time again. So we want to turn that why didn't I know to I'm so glad I knew. I'm so glad somebody took 5 minutes out of my session with them, their time, to talk to me about this, because now I know what to look for and now I know how to speak up. So let's go over some other common myths that you either might be thinking or you might get. Only those experiencing high-risk pregnancy should pay attention to their baby's movements. False. We want every single expectant parent to be educated on Count the Kicks and get to know what's normal for their baby. We don't just do the gestational diabetes test for those that are higher risk. We do that for everybody. Same with this. 10 and 2 or 10 and 1, a very, very popular one. I even heard this at the conference, right? And I stress that that is actually outdated information. So current research indicates moms should work to understand the normal amount of time each day it takes their baby to get to 10 movements each day. And again, if you are one of those that really likes research articles, we do have a research study on this. But basically what it says is that as human beings, we get so focused on that timing of it. And so what happens is when I say 10 and 2 or 10 and 1, what happens is if I'm counting, and normally I know my baby takes around 15 minutes, let's say, and one day I'm counting and it takes an hour and 15 minutes or an hour and 45 minutes. And I think to myself, that's okay. I got it within 2 hours. And my doctor always said 10 kicks in 2 hours. So, but what I didn't realize was that my normal is around 15 minutes. So that's a significant change I'm not aware of because I'm just trying to get 10 random kicks in 2 hours. So we just want to pay attention to what's normal for their baby. Here's another popular one, especially in the pandemic. I can use a Doppler device to monitor my baby's well-being. Again, a change of the baby's heartbeat is one of the last things that occurs when a baby's in distress, whereas a change in baby's movement may indicate a potential problem before the actual changes in the heart rate are detected. So expectant parents should only use a Doppler device under the guidance of a healthcare provider. Same with provider. If you go in with a change in fetal movement, they don't just check via Doppler, they're doing additional tests. Here's another old wives' tale. If baby isn't moving, I should drink cold water or eat something sugary. Again, research has moved away from the idea that sugary drinks and the like are a good way to get baby to move. Kick counts are best monitored without interventions like that, because if baby isn't moving like normal, parents should speak up to their provider right away. Why are we trying to force baby to move if something's going on? It's just like when you and I are sick. We are not chugging Mountain Dew or coffee to get going. We're not doing jumping jacks. We are resting. So let's not force baby to try to move if baby's not moving like normal. Babies kick less near the end of pregnancy. They don't run out of room. The types of movements may change because they obviously get bigger, but babies should move up to and even during labor. If an expectant parent is monitoring their baby's movements at the same time each day, it should still take about the same time to feel those 10 movements. Triage doesn't need this information. They absolutely need this information. So if you know somebody that works in triage, labor and delivery, if you have contacts, if you go to coalition meetings, this is the perfect time to share this information. I went to triage 3 different times with my daughter. 2 of those times I think were because of a change in fetal movement, or what I thought was a change. I didn't have the app at the time. It was before the app was created in 2015. And she would take 30, it took me forever to get her movements. When my other son, who I was comparing her to, which I shouldn't have because I didn't know any better, took 5 minutes or less. And so I went in to get checked out a couple times, make sure baby's okay. And it was fine. I just needed to know and understand that that was normal for her baby, or for my baby. And so that would have been the perfect opportunity for labor and delivery to hand me a brochure, to show me the poster on the wall, to put it in my after visit summary report. So remember, stress the importance of knowing their baby's normal and speaking up if there's a change. Make sure they know what number to call if there's a concern. It's all about empowerment. Send a brochure home with mom and or the app card, and we'll talk about that in a minute. Again, that research in the evening, but we talked about, tell mom to talk to her provider about it, bring it up if they're not talking about it, and that a provider should be talking about it at every single appointment in the 3rd trimester that they see. And you can talk about it every single time you see mom. Again, can you show me your Count the Kicks graph? What questions do you have about baby's movements? How is tracking going? I guarantee people are going to love talking about this and love talking about the way their baby moves. So I talked at the very beginning, my background in systems level change and how much I love it. So here are just some ways that you could easily integrate this into your workflow. If you are a nurse or provider, could you add this into discharge paperwork, just like triage, like I just talked about? Could you have your front desk staff trained to hand out a brochure when expectant parents come into your location? Do you have family care or intake forms that you could, when you ask about pregnancy, you ask how many weeks they're in, and then you can calculate when they'll be around that 3rd trimester, so you can talk about this with them. The glucose test we talked about, can you integrate this into your EMR, EHR records? Maybe it's a reminder in your own system that pops up and says, on your calendar, or even something simple like that is make sure to talk about Count the Kicks with Mary today. Is there ways that you can easily integrate this so you don't have to think about it? Are there booklets that you hand out? You could put brochures in and posters in and app reminder cards. So if you're on today and you want to talk more about electronic medical records integration, let me know. I would love to get something set up within your system. Super simple and easy to do it. We already have hospitals that have included it. But again, you want to be talking about this at every single time, and the more touch points, the better. So this is baby Margot, and she was saved by her mom, who said, quoted here, "I'm very fortunate that my OB office shared Count the Kicks information with me through posters on the room walls and a brochure, as it encouraged me to download and regularly use the Count the Kicks app, which is how I knew that my baby's normal movement pattern had changed." So you can put posters up in your restroom, in your waiting room. Are you going to coalition meetings? Do you go out and about in the community a lot? Again, you are our boots on the ground. It's because of you that we're going to make the change. So could you keep a stash of materials in your car and take it to the next library meeting you have? We have libraries that order these materials. As many touch points as possible is really what we want to see. Here's an example of our gold standard after visit summary. Happy to share this with you in more detail. Here is another example of a community-based organization out of Ohio that they serve around 2,000 expectant parents, specifically Black women, every year in this one organization here. And it's kind of like a one-stop shop. So they don't get to see them routinely. So they wanted to make sure they included some verbiage on their form that talks about Count the Kicks, kind of like a script for them as they're filling it out. So they at least acknowledge it and talk about it with their parents that come through. So it's something simple like that. I'd be happy to work with you on that. All right, here's my second favorite part. I get to play this awesome song, and for like 2 minutes, you get to scan that QR code or go to the website and click on order materials, click on South Carolina, and fill your shopping cart. And what's even better is you get entered to win another gift card for placing an order during this time. So not only are you entered to win for attending, but you're also entered to win for placing an order. So these are great pieces to put in, like I just said, waiting rooms, restrooms. I'm going to give you just a minute or 2 minutes to go ahead and place your order. I'm going to play this fun song, and don't go anywhere. Just do it at your computer or your phone and come back, and I'll start up again because we just have a couple slides left. So get to ordering. The music takes a little bit. We'll go there. Oops, I promise it will start.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Hey, bring me down.
All right, so hopefully that gave you enough time to order some materials or get started on it. So we'll keep going and we'll wrap it up, but we also have an online free CE training for you. Thanks to our partnership with the health department, you can take this training for free. No need to write down that long website. I will send it in the post-webinar email that goes out, but it's now 2.2 CEs. So super excited. You'll use that code right there, save babies-SC for South Carolina during registration to access the training for free. So it's similar to this, but it's a lot longer, and we have a whole new section on equity and inclusion, which we're super excited about. Another great resource is that you have, and you are fortunate to have 2 wonderful women in your state for ambassadors. So local women that in particular, Emily and Danielle have been touched by loss. They both lost babies to stillbirth. very passionate. They can do things like webinars like these. They can do interviews. They can come talk in person. They're just great advocates for us in honor of their babies that they lost. And so we value them. They're wonderful hard workers. They're Count the Kicks trained. And so they feel free to reach out to them. They also do a walk every year in honor of all the babies gone too soon, and in honor of their little ones. And so there's a website there, and I'll add that in the email, that you can certainly learn more about and join if you want as well, because it's a great way to get to know them and be in that community. Let's see here. Okay, and then here is our most recent South Carolina Baby Save. And so when I talk about baby saves, I'm talking about those people that have contacted us that said, I was using your app, or I learned about it. I knew I had a change in babies movement. I spoke up to my provider, and now baby's here because of it. And so we love these stories. We shout them from the rooftops. We know there are thousands more out there. These are just the ones that contact us. So this baby is Olivia, and she learned, her mom learned about Count the Kicks from Danielle, who you see here on your screen. So her story's on our website. She notified her doctor with a change in fetal movement around 38 weeks. Baby had to be delivered. And so this quote over here where it says, my doctor explained that the cord around her neck was likely why her movements decreased, and was just as relieved as we were to have her hair healthy. I will never be able to express my gratitude to Count the Kicks for teaching me the importance of truly listening to my baby. I just love that. So next steps, become familiar with the app, which you're already doing because you downloaded it while I talked. You're ordering materials, which you already did. And I know because I'm going to get an email notification, and then I'll do a drawing for an Amazon gift card. Talk to people about this every time you see them. So whether you're an NFP, you're a Healthy Start, share this with your team. Take this back. This is being recorded, so you can share this with your team. Absolutely. Have them take the CE training. Make sure everybody knows about this. How can you integrate this? Think through what you're already doing that makes sense to add a couple bullet points on Count the Kicks so everybody does this. Reach out to me personally, and I will help walk you through this. And then remember, hours and minutes matter in preventing stillbirth. So if it's the middle of the night and they can't get a hold of somebody, they need to go in. If they are in a rural area and their closest birthing center is 45 minutes away, but their family care clinic is closed, they should not wait the next day to go in. They should go to their nearest birthing center. And then finally, we'll add on a high note, Baby Save Nala. This is her story.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. Once she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously. Like, it's your baby's life.
Oops, too fast. All right, that's all I have for you today. So you learned about baby Nala, baby Ruby, you have a smile on your face, you order materials. I'm happy to answer any questions you may have. You do have to use the chat box because you're automatically muted. But if you raise your hand, I can also unmute you, I believe. I just want to thank you for spending this hour with me. I know we're all busy individuals, but hopefully if you knew about Count the Kicks, you learned something new, or this was brand new information for you. So I will send out an email here within the next day or two with the recording, a PDF of the slides, some of those links we talked about. So yeah, I just thank you all for your time. I'm, like I said, happy to answer any questions. If not, enjoy your beautiful 70-degree weather while I enjoy my now almost 90-degree weather. Thank you. Thanks, Cindy, you too. Thanks, Lacey. All right. Very helpful. Thank you. Shaniqua, that's beautiful. Hopefully I didn't butcher that. Awesome. All right. I'm not seeing any questions. I'm going to go ahead and end. You guys have a great day. Thank you.